Yes, welcome here back live from the Bella Center, where it's time for the Monday afternoon tea break. And as you are live with us on Facebook and YouTube, you get the latest and the greatest news, because I'm now joined by the first official winner of the ESOT Leonardo da Vinci Award. I'll hold it up for you right here. It's Emily Thompson. Emily, congratulations.
Thank you very much.
If you haven't followed that session online, make sure you join us on ESOTtransplantlive.org, where you'll be able to see a rebroadcast of your session, where you were with 5 other finalists.
Yeah.
Very tense, because when you walked in, you didn't know yet whether you would come out as a winner.
No.
You all presented your papers,
Yep.
Very innovative work, and then there was a vote,
Yeah.
and you came out as a winner.
I know.
How are you feeling?
Surprised and very, very happy. Yeah, I can't really believe it. There's the other contestants. I was sitting there listening to their stuff, thinking, wow, this is great. So yeah, I feel very privileged.
Well, let's take our audience a bit into the journey that you have been going through, and what you've been doing that is apparently so incredibly innovative that the editors of the leading transplantation journals and the audience here thinks it should win. The title of your paper was Reconditioning Marginal Human Kidneys Using Multi-Stem, which is a trademarked technology, cell therapy delivered during normothermic machine perfusion. Let's unravel that a bit. One of the things I heard that the editors picked up on was the fact that you used human kidneys instead of animal models.
Yeah, so this project is quite at on that translational spectrum. So we're using kidneys that had been turned down for clinical transplantation and putting them on machine perfusion and then delivering a human stem cell product. So it's as close to what we would actually do if this therapy was in the clinic as you can possibly get. So not a mouse model, not cells in vitro, which I think probably might have been why there was an interest in it.
Yeah, and for people who haven't had the chance to Google your background, you're still in your PhD phase.
Yep.
You've been working on this project for about 3 years,
Yep.
you just said me. Can you share me the moment which sparked the imagination of setting out on this journey?
I think normothermic perfusion has been a big, shift in how everybody thinks in transplant, and cell therapy always seemed like an obvious marriage to me with transplantation, but it's difficult to achieve successful cell therapy because when you deliver them in the vein, they'll get stuck in the lungs. So actually getting them to the kidney is difficult. But if you have a kidney on a machine, you can get those cells straight in. And so it was from there that I just pursued it further and further. And it seemed to work out quite successfully.
Yeah, so basically you say it's an opportunity that arises from this whole new development, and earlier we had our ESOT president talking about a new phase in transplantation where the organ is ex vivo and we can do all these kind of things with it.
You can do all these exciting things, cell therapies, gene therapies, specific drugs that you maybe wouldn't want to give to a patient because they're toxic. So it's really exciting.
And can you share a little bit about your research setup? What did you set out to do?
So we would you get a text message that tells you that the kidneys have been turned down for transplant. You accept the kidneys, they get delivered to the hospital, surgically prepare them, put them on the machines, and I would have both kidneys going simultaneously. One has the stem cells and one's the control. And I think that's one of the reasons this model's been so nice, because you can really tease out the effect of the cells. And that's one of the benefits of doing kidney research. In the liver, you can't have a spare liver from the same donor, so that's how we did it, and we took samples of everything, and then we also did scanning of the kidneys whilst they were perfusing to make sure there wasn't clots in the system, and yeah.
And just checking, what did you do to control kidney? Nothing, or just normal perfusion?
What the cells had been suspended in was just what we gave them, so it's just like a vehicle control.
Exactly, exactly. Yeah. And now, take us to the results. What did you find? What happened?
So my first objective was just to kind of prove that you could put cells in the circuit, because to me, a bolus of 50 million cells could clog up the kidney. So we wanted to make sure that it still peed, there was still blood flow, there wasn't any, changes in metabolism. And so we're trying to establish that it's feasible. And then we looked to see, okay, it's feasible. What's it doing? Is it changing cytokines? Is it changing biomarkers? And it was. And then it was the machine perfusion's great because you can do all these studies, but you can't understand what might happen after transplant by the machine. So then we took the samples and then put it back into other models to try and understand what might happen after transplant. And then thirdly, we wanted to know after we put the cells in the kidney, where they were going, what they were kind of sticking to, where they were ending up, were they going to damaged areas. So there was a tracking
And
element.
how did you research that?
So they were labeled with a fluorescent dye before they went in. So you could take sections of the kidney and find the cells. And also we kind of drained the circuit, spun it through a filter and captured out the cells that were circulating in the machine. So you could kind of understand both compartments.
What stayed
what's
left
in the
behind
kidney and what's
what
circulating.
was still circulating.
Yeah.
Okay, interesting. And well, in your title, it specifically mentions the normothermic perfusion. Why was the temperature so important?
So one of the other experiments we did was with cold perfused kidneys and put the cells in, but they just wash round, which is what we expected, but we felt we had to show that as well.
Yeah, to double check.
You need a metabolically active organ so that you can put in metabolically active cells so that they can interact. If you didn't have normothermic perfusion, it would just be a washing round effect.
Exactly. And to you now, what was one of the most surprising outcomes of your research? What was something you really didn't expect?
So I think it was when we were scanning the kidneys, because I devised that experiment because I was worried that there might be clots. And so I was trying to prove, hopefully, that it didn't cause any blockages. But what we actually saw was the total opposite, was that the blood flow opened up and you got new blood flow in hypoxic areas of the kidney, which was a great finding for us. And it also helped us kind of understand the mechanisms of how the cells are working. So we think they're going to hypoxic areas, becoming part of the tissue, releasing their secretome, and then they're reconditioning those areas, which is something that's very difficult to do with just a drug-based therapy because it doesn't have that biological ability to get to where you need it.
And develop in the place where they land. Wow, amazing. And well, this has been finished. Research done and dusted. Award won. The second award already, I understand. You also won the award at the British Society of Transplantation. So what's next? Where are you taking this?
So hopefully, we feel that this is almost there, ready to take to the clinic. There's probably a few more things we need to work out. The dose we used was a dose based on what they use in whole patients, so we did an equivalency. But we probably need to try lower doses, higher doses, and see if we still get the same effect. But after that, it's
because are there drawbacks? Are there side effects that you want to make sure you minimize the doses?
I think maybe not. That product, they always like high doses, and they think that higher doses are more effective. And on the machine, there's no human attached that you could let the higher doses might cause a problem with. But I think it's just that's a requirement of the regulators to make sure you've got the correct dose. Yeah. So that would be
the next. Need to be figured out, and once we have that,
potentially
clinical testing.
That's my hope, but it's never quite as easy as that. But I do think if we can get the funding to take it to a trial, we'd start in patients with marginal kidneys, putting them on the machine and seeing if we can get them to a transplantable level and implanting them.
Well, very, very exciting work. Now, winning the ESOT Leonardo da Vinci Award not only comes with eternal bragging rights. I mean, there's nobody else who can claim I was the first who won this award. It also comes with a 10,000 euro grant.
Very nice.
Everybody wants to know, how are you going to spend it?
I think the rest of the Newcastle team have also been asking, and we're probably going to go out for quite a nice dinner. Yeah. I'm sure that I can make a dent in that money in one of the bars in Copenhagen. Yes. And yeah, I had never thought I'd win the money, so I haven't got any plans for it.
Not yet, no. And the other obvious reason would be the rest would be in the future research of your work, maybe.
Yes.
Maybe. Yeah. Anyway, well, thank you very much, Emily, and thank you for sharing this story with us.
Thank you for having me.
I think that if you're watching that you could become a transplantation professional that we hear much more of. You're on your way to become a transplant surgeon, right?
That's the plan, yeah.
So good luck with that as well.
Thank you very much.
Well, you're starting off on a high. Earlier today, I was in this little studio where we also have our Copenhagen bicycles. And I was able to get the chairs of this ESOT 2019 Congress on the bike, Ellen Rasmussen and Finn Gustafsson, to have a little chat about their journey towards this Congress as it is today and how they reflect on that. So let's have a look.
Okay, Alan. So day 2 of the ESOT conference. It's been a few hectic days, eh?
Yeah.
I was thinking back. Do you remember exactly when did we decide to embark on this journey and do this?
Yeah, I think so, actually. We had a very nice experience organizing the Scandia transplant meeting in Copenhagen in 2014. And we did that together. And we had a meeting, I think it was at the board at the Danish Transplant Society. And I told you, ESOT is asking who's gonna apply for hosting ESOT 2019.
Yeah, I remember that.
That was half a year after what we felt was a good success. We actually enjoyed arranging this Congress together.
Well, that was a smaller meeting.
That was a smaller meeting, and then we said, oh, when we can do that, let's go for the big one.
Yeah, I think that's right. I think that's how it went, and then Copenhagen won the call, and then we were in it.
Then we were in it, and we didn't know what we were going into.
So I mean, we've been really busy up until this meeting with the meetings and the planning and everything. Have you enjoyed that, or has it just been too much work?
No, I think in the beginning, I mean, we had to find out what is our role in this and what's the Secretariat's role and how are we going to do this together. And it took a little while because obviously it was very different from creating a small meeting like the Scandia transplant meeting where we almost decided everything, even the color of the plate we were eating from.
I remember that.
To this, where it was quite a lot different.
Much more professional organization, of course.
Yeah.
But I think one of the really fun thing about being in the planning process of this has been getting to know people from not just other countries in Europe, but really interesting, dedicated people from other specialties. So I think that's been very interesting for me to work with these people and actually creating this from scratch is really has been interesting, I think.
Very.
I think one of the things that we really and I have put a lot of effort into, and that has been more challenging than anything else, I think, was the planning of the plenary session yesterday.
I remember when we had the first meeting in the organizing committee in Copenhagen in the spring. It must have been 17.
I think 17. So, yeah.
Anyway, and we accepted that we would take responsibility for planning the plenary one. And it's a bit of a challenge. It's so important to get a good start. But nobody tells you what it's all about because you can do anything.
It's a blank page.
Yeah, exactly.
Yeah, and we had some really interesting ideas along the way.
Oh, yeah.
Politicians, influencers, all kinds of stuff. But I think it was interesting that we tried to create something that had connection to Denmark and something that had connection to at least biology somehow, but also at the same time was not transplant. I think that was a lot of fun, but also gave us challenges because these were people we were not used to working with. Some of them.
You can say that, but I mean, we agreed it should be something hot, and it was quite obvious that CRISPR, for instance, came, and there was a lot of hype about that. That's hot, and genetic research. I mean, it's quite easy in Copenhagen, and in Denmark we have Eske Willerslev, who is really a leader in the world in this field.
Yeah, he's amazing.
It should be something hot. The people presenting should either be Danes or top scientists working in Denmark. And then from there on, it became a lot easier.
But capturing Eske Willerslev between trips to Mexico and Mongolia, digging out something, getting old DNA from I don't know what, and actually keeping him here for the required number of hours was a challenge.
That was a challenge. Even his PA sometimes even hardly knew where he was.
I think it really was worth it because he was excellent, and I think the discussions yesterday were outstanding. So I think I had a lot of fun with that.
It has been such a pleasure working with him because he's a really, really famous top scientist in the world. He's completely down to earth and so easy to collaborate with. And then he suggested a couple of other researchers, like Kurt Brake-Busch. I actually didn't know we have a capacity like him just next door.
No.
I mean, he's a professor at the Copenhagen University, and his office is it 200 meters from ours?
And we didn't know about him.
And we didn't know about him. We certainly do now.
I think the great thing was that Eske also suggested people that he is widely disagreeing with. So I think that was also creating a great scene for us. So that was so to some extent, after we caught Eske and captured him and had him, that made the rest a little easier, I think.
Yeah, and it says a lot about Eske that the first person he mentioned was Rasmus Grønfeldt.
Exactly.
So he's a Dane. He's not living in Denmark. He's actually a professor at Santa Cruz in California, and he has a chair in Chicago as well, and he's very famous in his field. And he disagrees a lot in what I'm saying, and he's challenging me all the time. It says a lot about Eske that he wanted a guy like Rasmus to be there instead of somebody who was just agreeing on all what he was saying.
So Alan, with all this work, all these meetings, all these late nights and everything, with the planning of ESOT 2019, would we do it again?
Yeah, we probably would.
Hello and welcome back, still here in the Bella Center at the hallway studio of Transplant Live. If you're now watching this on Facebook and YouTube, it's glad, we are happy to host you here, but you should know that you're missing out on some of the best things, because every session in the big rooms is being recorded and live streamed to ESOT Transplant Live. So if you haven't done so, hop over. Those who were there have just seen Plenary 2. If you're not, let's summarize, because I'm now joined by Menna Clathworty from Cambridge in the United States. You were chairing the Plenary 2 session and also one of the first speakers, which was titled Single Cells Omics, Generating an Atlas to Chart Transplant Organs.
Yeah.
In your first talk, you introduced the Human Cell Atlas. For our viewers who've missed that, what is that?
Yeah, so the whole session was how we might use omics technologies to better understand transplant organs, and maybe even in the future to build transplant organs. So at the heart of that is the Human Cell Atlas project. So this is an international consortium, so a group of clinicians and scientists with various expertise that have come together with the aim of trying to generate a comprehensive atlas of every single cell, in every single tissue, in every single organ in the human body.
Wow.
And we kind of feel that by characterizing cells in normal tissues, we can then move on to understand how they change in disease, and that will give us insights into what we can do to prevent that. And so what I went on to do from there was just to describe a little bit about how much the Human Cell Atlas project has developed.
Because where are we? Is it, first thing I'm already blown, like, is this possible? Well, apparently, that's why you set out on the journey.
Yeah.
Right?
So we've been doing this, so the consortium came together in 2016, so we've been doing this for 3 years. But already it's expanded massively, so we have more than 1,500 members of the HCA consortium, and from more than 60 countries. And
who are they? These are researchers throughout the world, sharing data?
Exactly, and that's really an ethos of the HCA project, is that we want to share data as quickly as possible. So generally we try and make all of our data open access so that other researchers out there can use the data to take the whole field forward. And so what's allowed this is developments in technology. So now, whereas previously we would generally, and in transplantation in particular, take whole tissue biopsies and have a look at the mRNA transcripts within the biopsy.
Yeah.
Now we can actually take individual cells, not just a whole biopsy, individual cells, and look at the messenger RNA transcripts. And that allows us to define sometimes new cell types that we didn't know about. So there was an example of that last year where in the lung they found a brand new cell type. the ionocyte, and that cell type actually, it turns out, expresses the cystic fibrosis protein.
Okay, so a very important marker.
Yeah, a very important marker. And then in terms of the kidney cell atlas, which I've been involved in building, we've actually been looking at kidney in human embryo, so to look at kidney development. And that gives us information that will be useful for building organs. So if we're trying to generate organs from stem cells from scratch, knowing the signals that allow cells to become differentiated cells within an organ is helpful.
So just to really understand, so you're literally researching how in an embryonic state organs develop from single cell multiply, and then which elements are built on top of which?
Yeah. So what we can do is take kidneys at different post-conception weeks, so from very early on, look at the cells and their transcriptome at that stage, and then compare that to a few weeks later. And then we can make a trajectory of cells and ask, how does their transcriptional state change as they become more mature?
Well, very exciting work.
Yeah.
Now, obviously, people can go into the Transplant Life library and see the entire session.
Yeah.
Last question, if people are inspired by this cumulative effort, how can they step in and join the movement?
Yeah. So you can go to the website, so humancellatlas.org, and you can just sign up there and
start sharing your data.
Yeah. And then we're also trying to make our data available so that researchers out there can interact with it. So we've made a simple website, so Kidney Cell Atlas, that you can again log into, and maybe if you're interested in a particular gene and where it's expressed, you can look exactly where it is in the kidney.
Wow.
So yeah,
very exciting work, and thanks for sharing that here in the Congress.
No problem.
This Congress is moving on, so we're taking our viewers live into the Inspire and Drive session number 2, which is all about whether evidence-based practice is killing the art of medicine. And if you're watching us on YouTube and Facebook, we're going to switch off this broadcast, so hop over ESOTTransplanTlife.org and join us in room A1.
Stefan, it's a good trick not to have to write as long a talk, to have so many things that the chairman actually has to introduce at the beginning. So that nibbles about 30 seconds off. Thank you very much indeed. So what I've been asked to talk about is to introduce this session by asking